New at 5, it's a fact of life. A visit to a hospital is usually never cheap. But a new study shows that hospitals owned by several companies based right here in the mid-state are some of the most expensive in the entire country. News Channel 5's Jason Lamb is here with a look at the numbers. Jason.
Well, that's right, Rory. So we all know the story. You go to the hospital and get a bill several weeks later after it goes through your insurance. But hospitals often charge different amounts for the same thing. So this study looked at the difference between the price that Medicare pays for, say, a CT scan or an overnight stay, and the price the hospital charges you or your private insurance company for the exact same thing. Now, this is the top of the list according to the Rand Corporation. There were 4 healthcare systems based here in the mid-state. This is HCA Healthcare. They say they're billing you and your insurance company 303% of what Medicare pays for the same services. Community Health Systems at 305%, LifePoint Health at 376%, and Quorum Health at the top of the list, billing you and your insurance company more than 4 times what Medicare pays them for the same procedure. So why is that the case? Experts say one reason may be the market itself, where one company may own several hospitals in the same area. That gives hospitals more power and insurance companies less power when they negotiate prices. But they say hospitals have to make ends meet, and they sometimes have to cover for patients who don't have insurance. As more and more people switch to high deductible plans, patients shoulder more of the cost, and experts say it's likely that patients will begin demanding billing that's easier to understand.
And it means they're going to demand more and more transparency about that pricing. And they're potentially going to go and shop more, which means that organizations are going to have to provide pricing and allow that patient to make the best decision for them.
Quorum Healthcare, here at the top of the list, say they question this study. They say it only looked at less than 1/3 of its hospitals, and they question how the study was carried out. Rory?
All right, Jason, a good time to remind you here at News Channel 5, we want to help ease the crushing burden of medical debt. It's our series called Medical Debt Rescue. Now, we've donated $15,000. That has erased $1.8 million worth of medical debt, no strings attached. We'd like to erase even more with your help. So go to newschannel5.com and click on the Medical Debt Rescue tab to find out how you can donate.